This is One-on-One. Back by popular demand to explain some things we still don't understand is Jim Albano, our good friend, Vice President, Network Management at Horizon Healthcare Innovations and Horizon Blue Cross Blue Shield, New Jersey. Jim, the reason I'm saying that is we're still trying to make sense of all this, but what I want you to break down for us is Horizon Healthcare Innovations. There are three key pieces to it, right? First piece, patient-centered medical homes. What is it?
Well, so Steve, the real concept behind PCMH, Patient-Centered Medical Home, is that the family practice doctor, the doctor that you would go to for your regular checkups or if you have minor issues, is really the center of all of the care that you receive. We refer to him or her as the quarterback of your care. Quarterback.
Now, all this, folks, if you want to understand what this is about and why we're doing it, it's because it's patient-centered care. It's changing the model of care from what to what?
Very much so, changing the model.
From what to?
Basically, the experience today is a very short, succinct visit around a particular issue. So if you're not feeling well, or maybe even just for a well checkup, that's the current model. PCMH is designed to get at all of the aspects of your health and well-being. And again, that family practice doctor's role is to help you coordinate anything and everything you have to do, including things like exercise, which there might not have been time to have that conversation in the old model where the physician was sort of running from exam room to exam room, trying to get to as many patients as possible.
So Jim, respectfully, where is this doctor getting this time all of a sudden to do this, to have these conversations about exercise, diet, overall health, this holistic conversation? Where's that happening?
Yeah, so
How's it happening?
That's exactly the right question, Steve. Horizon Blue Cross Blue Shield of New Jersey, among lots of other health plans across the country, in developing this model along with the physicians. We didn't do it in a vacuum. We did it with the physician community. We're actually paying an additional reimbursement to physicians to do that care coordination, over and above what we've always paid to those doctors for an exam. We call that a care coordination fee.
A care coordination fee. So we're going to pay you to
basically engage with each and every patient, to understand his or her lifestyle, understand all of the issues and facts around their health. And again, if they need to see a specialist, if they have a cardiac issue, then that family practice doctor will facilitate getting to the right cardiologist.
How do we know, Jim, that this has the potential to have a more positive impact on patient outcomes?
Right. So we're measuring two things in our program. And again, we worked with the docs to develop this, a list of quality metrics, things like preventive screenings, mammographies and colonoscopies, general health and well-being types of things that sometimes get neglected in the old model. We're actually using those as metrics for the PCMHs.
We could go back to that jargon again's throwing me off, that acronym.
The Patient-Centered Medical Homes.
Go ahead.
So we use that for the program, and we pay based on the increases in those instances of screening tests. And we'll pay additional incentive-based compensation to the doctors for increasing those rates.
All right, you ready to confuse things? Oh, you ready for me to try to?
Sure.
All right. ACOs, you did that acronym before for the patient-centered thing.
Right.
ACO stands for?
Accountable Care Organization.
How is this so-called accountable care organizations, which we keep hearing about, after the ACA, which is?
The Affordable Care Act.
Otherwise known as?
Obamacare.
What the heck is the connection, Jim? Follow us on this, folks.
Yeah.
I think we're going to need some sort of map. What is the connection between accountable care organizations and everything you just said?
So accountable care and that concept is as you said, in the Affordable Care Act.
What is it?
It's basically
Is it an organization?
It's an organization. It's a separate entity of medical professionals coming together to take full accountability for patient population health.
For example?
So we have ACOs in New Jersey. The Atlantic Health System, as an example, has an ACO. Hackensack has an ACO. There are a number of...
Barnabas has an ACO.
Barnabas
different
has an
people.
ACO.
So why would a hospital have an ACO?
Well, so they're really trying to bring together all of the aspects of care in a single entity, so the full continuum of care from basic family practice all the way up to the more complicated and serious
Devil's
things.
advocate, why can't they do it with the regular hospital model?
Because
Fee-for-service
it's
model.
fragmented. There is no coordination in the regular model. You might see
Coordination of care?
coordination of care for a particular patient. You might see multiple specialists who never talk to each other. So the entity, bringing the organization together, is designed to have all of those professionals work together. And then Horizon, again, as a health plan that's financing the care, puts in metrics and incentive-based reimbursement based on the outcomes for that particular patient.
Translation. Are you saying that your company, as the biggest in our area, right?
Yes.
You will pay more for those who form these accountable care organizations because you're arguing that the outcomes tend to be better for patients?
It's performance-based compensation. So the better the quality scores, the better the outcomes, and outcomes are measured by things like lower rates of readmission to the hospital for the
So you
same
don't go back to
condition.
the hospital for
Right.
the same thing you had.
Exactly. So we're gonna reward an ACO that accomplishes that because they've improved the care and experience for that patient.
Okay, so there are three pieces to this so far. I'm going to get to the third. The first piece is the patient-centered medical homes. The second one is ACOs, accountable care organizations. The third, episodes of care.
So that's really putting definition around a particular event in your medical history. So for example, if you need a knee replacement, that's a single event in your life. You don't have usually multiple.
It's an episode.
Right. So what we're trying to do there is today things are very fragmented in terms of you might go to a physician who tells you have to lose weight before we're going to do anything with your knee because that's putting stress on the knee, and we'll pay for that. Then we'll pay for the surgery related to the replacement, and then we'll pay for the rehabilitation or physical therapy afterward, and all of those are separate in today's world. In an episode of care event, we're trying to get to a point where we pay a single amount
To whom?
to that orthopedic surgeon to coordinate all of the pre and post-op care for that particular patient.
The surgeon gets a certain amount.
Right.
And what? The surgeon spreads the money out to whomever?
Well, we help with that process. We, the health plan, Horizon, helps allocate the dollars, but we're trying to put the orthopedic surgeon in the driver's seat.
How does that help the patient?
Well, so if you have a single point of accountability, that individual is watching out for example, to make sure that there aren't too many
That
physical
individual
therapy.
meaning the orthopedic surgeon.
Tries to make sure there aren't too many physical therapy visits, that the right number of visits are applied. And working within a budget, you have motivation to try to control costs in that environment.
But respectfully, Jim, what happens if we find out that in a few seconds, what happens if that patient we find out needs more physical therapy than originally thought because the patient's not recovering as quickly as the orthopedic surgeon thought would happen? I mean, what do you do then?
So then
it didn't work out on the model. The patient needs more.
Right. So that's where Horizon is collaborating with physicians like orthopedic surgeons, and we'll work together with that doctor and allow for additional reimbursement if that's appropriate in that particular patient's case.
Would you agree this is complicated?
Yeah, it is complicated. There's no question about that. Okay. But I think that the key principle
A few seconds.
in all of this is we're working together as opposed to in a fragmented way.
Reason for hope, but boy, you got to keep doing your own research, and you are your own best advocate by educating yourself. Jim Albano from Horizon, thank you so much for joining us. We appreciate it.
Thank you,
Thanks,
Steve.
buddy.
Appreciate it.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by New Jersey's credit unions, the New Jersey Education Association, New Jersey Natural Gas, United Water, New Jersey Sharing Network, and by the Healthcare Foundation of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.